Hello, I'm Suzanne McCahan. I work in the Nemours Biomedical Research Informatics Center, and I am here to talk about the N3c Data Enclave today. There we go. And I'm assuming that everybody can see my slides. So the N3c Data Enclave is a powerful national resource for COVID-19 research. N3c stands for National COVID Cohort Collaborative, and the Enclave includes a large electronic health record repository from over 300 over 771 sites that are providing data, and that includes Nemours. And the data are medical records from patients who were tested for the novel coronavirus or who had related symptoms. The Enclave also includes a powerful analytics capabilities. There's the ability for online discovery, visualization, and collaboration. And the tools that are available in the Enclave are R, Python, SQL, various dashboards, public data sets, and more will be added as people use the Enclave and find that they want additional tools. Overall stewardship of the N3c Data Enclave is by NCATS, that's the National Center for Advancing Translational Sciences. And this resource is available to DECTR and Nemours investigators free of charge. All of the work that is done with the data is done within the Enclave, which is in the cloud. You cannot download data to use it. You need to use the tools that are available in the Enclave. There are N3c Domain Teams that have been created and are continuing to be created. These teams enable researchers to collaborate in a team science environment. As you can imagine, working in the cloud can be challenging, and this is big data and complex research questions that are being asked. So it requires a team of people who have different expertises to really use the Enclave efficiently. And so these teams are being formed, and the teams are comprised of clinical and subject matter experts, statisticians, informaticists, and machine learning specialists. And anyone can join a team or even start a new one. Some of the teams that exist already are focused on acute kidney injury, diabetes and obesity, pediatrics, the immunosuppressed or compromised, and social determinants of health. There are three data access tiers for the N3c Data Enclave. The first tier is synthetic. This includes artificial data that's been designed to be statistically comparable to the original data. It does not contain PHI. The second tier is de-identified data. This is patient data without PHI identifiers. And the third tier is a limited data set. This is patient data that contains 2 PHI elements, and it includes zip code, and dates. The requirements for access differs for each tier, and Nemours and DECTR investigators are eligible to request the use of any tier of data. There are several items that are required when you request access to the NC3 Data Enclave. We've created a list to help people get things together before they actually start working in the Enclave or trying to get access to the Enclave. One thing that's necessary is an institutional data use agreement. Nemours has a DUA in place, so any Nemours investigators are already covered in for this. Other DECTR institutions must each have their own separate DUA, and those DAAs, preparation of those DUAs is in progress now. Everyone needs a personal ORCID ID. This allows for identification of individuals and tracking of the things that you do so that you can, within the Enclave, so that you can be acknowledged for the work that you do in the Enclave. You need a two-factor authentication app, and there are several that can be used. Current human subjects research training is needed, and that can be city or NIH. And this does not apply to the synthetic access tier. Everyone must have current NIH information security management training. You need project information. You can join an approved project, or you can also propose a new project. And an IRB letter of determination is needed, but that's only needed if you're working on a project that applies to the limited PHI access tier. The information that you need if you're proposing a new project are the title of the project description, and that must be COVID-19 related, project abstract, a project rationale, and the rationale should include which data tier access is requested and a justification why that level is needed. Collaborators are optional. You include name, institution, and email address. Collaborators do not need to be at your institution. They can be at other institutions. Whatever institution they're at must also have a DUA. The lead investigator's name, project title, and project abstract of approved projects will be made public. We've gathered some links and help. We've developed some web pages for NMORS and DECTR investigators to just sort of organize the information, give a little bit more information than what I've talked about here, and also links to other pages with even more information. To request help in obtaining access to the data enclave, or formulating a data use request, or for using the data enclave, we have a couple links. One is for DECTR members and Delaware Valley Associates. This is the BIRD request system. And then the other other link is for NMORS Associates who are not in the Delaware Valley. And I also have a link here to the NCAT's N3c website, and also a link to the N3c website. And that is all of my slides. Are there any questions?